Kisses TV.
Ten most deadliest disease in the world 2020.
Number 1.
The deadliest disease in the world is coronary artery disease, CAD. Also called ischemic heart disease, CAD occurs when the blood vessels that supply blood to the heart become narrowed. Untreated CAD can lead to chest pain, heart failure, and arrhythmias. Although it's still the leading cause of death, mortality rates have declined in many European countries and in the United States. This may be due to better public health education, access to healthcare, and forms of prevention. However, in many developing nations, mortality rates of CAD are on the rise. An increasing lifespan, socioeconomic changes, and lifestyle risk factors play a role in this rise.
Number 2.
A stroke occurs when an artery in your brain is blocked or leaks. This causes the oxygen-deprived brain cells to begin dying within minutes. During a stroke, you feel sudden numbness and confusion or have trouble walking and seeing. If left untreated, a stroke can cause long-term disability. In fact, strokes are the leading cause of long-term disabilities. People who receive treatment within 3 hours of having a stroke are less likely to have disabilities. The Centers for Disease Control and Prevention, CDC, reports that 93% of people knew sudden numbness on one side was a stroke symptom. But only 38% knew all the symptoms that would prompt them to seek emergency care.
Number 3.
A lower respiratory infection is an infection in your airways and lungs. It can be due to influenza, or the flu, pneumonia, bronchitis. Tuberculosis viruses usually cause lower respiratory infections. They can also be caused by bacteria. Coughing is the main symptom of a lower respiratory infection. You may also feel breathlessness, wheezing, and a tight feeling in your chest. Untreated lower respiratory infections can lead to breathing failure and death. One of the best preventative measures you can take against lower respiratory infections is to get the flu shot every year. People at high risk of pneumonia can also get a vaccine. Wash your hands regularly with soap and water to avoid transmitted bacteria, especially before touching your face and before eating. Stay at home and rest until you feel better if you have a respiratory infection, as rest improves healing.
Number 4.
Chronic obstructive pulmonary disease, COPD, is a long-term, progressive lung disease that makes breathing difficult. Chronic bronchitis and emphysema are types of COPD. In 2004, about 64 million people around the world were living with COPD. There's no cure for COPD, but its progression can be slowed with medication. The best ways to prevent COPD are to stop smoking and to avoid secondhand smoke and other lung irritants. If you experience any COPD symptoms, getting treatment as soon as possible increases your outlook.
Number 5.
Respiratory cancers include cancers of the trachea, larynx, bronchus, and lungs. The main causes are smoking, secondhand smoke, and environmental toxins. But household pollutions such as fuels and mold also contribute. A 2015 study reports that respiratory cancer accounts for about 4 million deaths annually. In developing countries, researchers project an 81 to 100% increase in respiratory cancers due to pollution and smoking. Many Asian countries, especially India, still use coal for cooking. Solid fuel emissions account for 17% of lung cancer deaths in men and 22% in women.
Number 6.
Diabetes is a group of diseases that affect insulin production and use. In type 1 diabetes, the pancreas can't produce insulin. The cause isn't known. In type 2 diabetes, the pancreas doesn't produce enough insulin, or insulin can't be used effectively. Type 2 diabetes can be caused by a number of factors, including poor diet, lack of exercise, and being overweight. While diabetes isn't always preventable, you can control the severity of symptoms by exercising regularly and maintaining good nutrition. Adding more fiber to your diet can help with controlling your blood sugar.
Number 7.
When you think of Alzheimer's disease or dementia, you might think of a loss of memory, but you might not think of a loss of life. Alzheimer's disease is a progressive disease that destroys memory and interrupts normal mental functions. These include thinking, reasoning, and typical behavior. Alzheimer's disease is the most common type of dementia. 60 to 80% of dementia cases are in fact Alzheimer's. The disease starts off by causing mild memory problems, difficulty recalling information, and slips in recollection. Over time, however, the disease progresses and you may not have memory of large periods of time. A 2014 study found that the number of deaths in the United States due to Alzheimer's may be higher than reported.
Number 8.
Diarrhea disease is the second top cause of death in children younger than 5 years. About 760,000 children die from diarrheal diseases each year. Diarrhea disease is the second top cause of death in children younger than 5 years. About 760,000 children die from diarrheal diseases each year. Diarrhea disease is the second top cause of death in children young. Diarrhea disease is the second top cause of death in children younger than 5 years. About 760,000 children die from diarrheal diseases each year.
Number 9.
Tuberculosis, TB, is a lung condition caused by bacteria called Mycobacterium tuberculosis. It's a treatable airborne bacterium, although some strains are resistant to conventional treatments. TB is one of the top causes of death in people who have HIV. About 35% of HIV-related deaths are due to TB. Impact of TB around the world. The cases of TB have fallen 1.5% each year since 2000. The goal is to end TB by 2030.
Number 10.
Cirrhosis is the result of chronic or long-term scarring and damage to the liver. The damage may be the result of a kidney disease, or it can be caused by conditions like hepatitis and chronic alcoholism. A healthy liver filters harmful substances from your blood and sends healthy blood into your body. As substances damage the liver, scar tissue forms. As more scar tissue forms, the liver has to work harder to function properly. Ultimately, the liver may stop working.